Very, very, very effective to treat BPH.
If I may come in here, because there are two things you mentioned that I really want us to look at. Because if, assuming there was that study about Reverend Fathers having this issue, and up till now, Reverend Fathers, the Catholic Church have not made it possible for Reverend Fathers to get married, to be able to exercise their prostate.
I will not speak for the Catholic Church.
They all got medication.
For the authority
it's an oath they took.
Okay,
so
they decide that they want to live a cerebral life, whereby they don't want to
life for celibacy.
Celibacy means that they don't want to meet women. That is their. But how about their health? It affects their health as well.
Sexual health.
Okay.
Because I'm not a medical practitioner, but we always see this medical advice that preventive medicine is the best medicine. So if we need to keep the prostate active for it to be healthy, then people should.
But that's not the only cure. Lifestyle also happens. It takes place like that. Like the kind of food you eat. So we actually encourage people to actually, go on vegetable and fruits as well. A lot of vegetable like tomatoes that contains secondary metabolomes and lycopene has been very useful. I'm sure carrot itself that has high amount of zinc might play a role, but probably abstaining from too much of red meat, for instance, you can actually help reduce your chances of having prostate issues. So I think especially that of BPH and that of prostatitis could be bacterial infection that causes inflammation, and whenever you pee, you feel that pain as well. So those things, but lifestyle on its own probably does that. So it doesn't mean that if you ignore the lifestyle, you're not concentrating on sex, that you have cured your problem. I don't think it works that way. It means that you need to keep your lifestyle as well, keep everything in balance. As you're eating well, balance them with a lot of vegetable and fruits, and probably reduce the way your alcohol intake and stuff like that. Then, if you're married, then probably engage in sex a lot, because you see,
to help my brother here.
Yeah.
You see, the management and that most work centers on when it is prostatitis, when it is inflammation, bacterial infection of the prostate, or when it is in benign prostatic hyperplasia stage. Within that stage, the management and intervention of it is the responsibility started by qualified medical doctors to start treating. It's not what you will start treating yourself. And then your personal lifestyle will not help. For instance, in case of prostatitis, affected persons should be available enough to treat the infection. Don't do self-medication. Don't say, because I feel I have infection, let me go and buy drugs and treat myself. No. Okay? And reduce the intake of alcohol, caffeine, fats, because these ones stimulate the prostate to produce more of the oxidative stress, causes bladder irritation and excess urine. So that's why I said, first of all, it's centered on our lifestyle. What we drink, what we eat, play a role in killing us or keeping us alive. Okay? And because alcohol inhibits vasopressin and inhibits the reabsorption of water. Okay? So it makes us, once you take alcohol or you take coffee or caffeine stuff, you keep going to toilet. You keep going to pee. Okay, that means it's triggering the bladder wall and the prostate wall to keep sending the information to your brain. I need the pee. And it's either you pee normal if it is prostatitis, or when you get to that hyperplasia stage, you want to pee but you're not peeing. You start stretching, start pulling the muscle of your stomach just to push the urine out. Okay, now the last stage of it, when it gets to the increased intake of antioxidants, it helps in mopping up or generating oxidative stress and infection and prevent BPH. Now, what it helps here is antioxidants that includes vitamin C, vitamin D, lycopene, polyphenols and flavonoids are part of what you can use to bring down the hyperplasia stage of that prostate.
Like I said before, those things you mentioned, like all those nutrients like vitamin C, D, and secondary metabolites, like because vitamin C and D are primary metabolites. You can all get them from fruits, from plants you eat. Okay. You understand all the vitamins, all the stuff like you see most of these medicinal plants like bitter kola on its own has high amount of flavonoid. You understand? And it also has high amount of saponin. Polyphenols can also be gotten from some of them like that, and probably vitamin C, like all your fruits, your normal orange or your apple, do give you all those kind of vitamins. The most important thing is to avoid high amount of red meat you eat and eat more of vegetables, because they release all these things you take. And once these things are able to do that, they actually act as antioxidants, you understand? And this antioxidant try to moderate the enlargement of your prostate gland, and that's just one thing.
Now, we've talked about the scientific and the medical part quite a lot. Now, let us talk about the social part, because I remember you mentioned earlier that people of my community, people of my color, people of Africa, where I come from, are more prone to this problem, and I'm a bit worried. So okay. I want you to, tell us how to manage this situation so that we don't get into this prostate problem.
Well, lifestyle, whether we are Caucasian or African, Afro-Caribbean origin, lifestyle matters first. Okay. 2, how many of us are living a life full of exercise? How many of us takes our exercise so serious, or what we eat? Mostly we from Africans eat too much of chili. We eat too much of beef, red meat. Red meat is not good for our health. At a stage, once you clock 40, you should reduce your red meat intake. You should reduce the type of alcohol to those that smoke or drink. The type of life we from Africa lives, we don't eat or live in moderation compared to our Caucasian friends and brothers.
It may not be true. Some of them here do drink a lot more than Africans I've seen, and do that. But I think from research I've seen so far, one of the reasons why African people tend to have high amount of BPH or probably prostate issue, so one is ignorance. You see, some of them don't even know the symptoms. Good medical health facilities like you have in the West, you understand, actually helps prevent those things at an early stage. And an African man could be peeing all his life. He must have had prostate gland enlargement. That's the BPH. That's the hyperplasia. He would probably ignore it. Some of them could be out of shame, but mostly ignorance and poor medical facilities. Because some of them, once they ignore it, they could be like, they don't know that's a serious issue that affects them later in their life. Maybe they experienced it when they were 45, 50, keeps increasing, then 60 becomes severe. And that's when they now remember they need to go to the doctor. That's one thing. Then 2 is high testosterone level. You see, we Africans have very high amount of testosterone, more than the probably, I'm sure, let me say the black race. Let me go to the racial part. The black race have more than the Caucasians. So this high testosterone level could contribute.
Doc, you need to this medical term. Yeah, you need to make it simpler so that people understand.
Testosterone is like a hormone.
That does what?
A lot. You see,
for example,
let me tell you what you see in men. For instance, testosterone can also be produced in female by a very, very small amount.
Okay.
You understand? But in men, it produces a very high, so it gives us this cracked voice. You understand? This voice, these broad shoulders, and probably make us grow bears. Everything, the secondary characteristics of a man. When a boy is born, and the boy and the girl look alike, but when they get to the age of puberty, they start releasing testosterone. Men, ladies will release more of estrogen. And you see, women will start getting that sonorous voice, developing breast, having menstruation.
Okay. Like
all those things.
Some women that have beards,
they
have a high level of testosterone in their blood.
Testosterone.